sort of throwing this whole thing together. And we have some ideas about ways we can go forward. What we definitely don't want to happen is for us to all go away and say, well, that was really interesting, and then not do anything else. So we have a great opportunity here, having you all here as an asset from what is up here in your minds and the experience you have. Many of you, as I said before, are experts. You have a lot of great ideas. Those of us up here have just one little piece of the puzzle, or maybe a few pieces. We have a few ideas. Some of them might be half-baked ideas. So we really, really want your input right now. And we want to mobilize all of you as an army to go out in the community and help us to make a difference. So if you'll pull out of your packet, there are two things. One is the sheet that's a commitment card. I believe that's the yellow one. Is that right?
Yep.
Start looking at that, and while we talk, try to get that done, and please turn it back into us, and make sure we have accurate contact information. And then the other is just a plain white sheet of paper that we're putting up on the overhead here, suggested action plan strategies, and you'll see that it says draft. That's not because we accidentally put the draft up here instead of the final. It is a draft, and we're asking for your feedback. So we would also like you to use this to add your comments to some of these ideas. It's front and back, so we have a lot of ideas, but we may not have all the ideas, or maybe some of these are not good ideas. We're very open to your feedback. So please fill this out where you have some place you want to chime in, and you'll notice there's some blanks for other suggested strategies. Please add those in as well. And I guess now that I think about it, you may want to choose to put your name on here as well, just in case you've got a great idea and we need to talk to you about it. So we're just going to go through these together, and there are microphones front and back. We would like some feedback on these. So number one is to organize volunteers in a speakers bureau to raise awareness among parents, schools, and other community groups. It sounds like there are niduses of that going on, like what you talked about going on in Hoover and Homewood. But we would propose that this be hosted by the Addiction Prevention Coalition. They have already committed to having some of their staff help to coordinate this effort.
Mark, can I add one thing?
Please.
I know I've had side conversations today with half a dozen people about ideas that they have about elements that need to be an effective community plan. So we have these ideas that we want to begin to talk through, but then at the end of this session, I think Shandor is going to announce the date that we've picked to bring the group back together to develop a final plan. Between now and then, we need to have a lot of these side conversations to flesh out specific items that need to be in the plan. And we see this as maybe the most sort of nebulous of the group. You know, it's not very specific. There may be a lot of subparts to this. There may be some peer-to-peer. Perhaps there will be a seminar for parents. So if you're still thinking through the ideas and aren't prepared to talk about it today, by all means, use your commitment card or some other mechanism to write out your idea to say, I think this needs to be a part of the strategy, and you can call me at this phone number so we can work on it some more. This is an ongoing process, right?
Right. Shandor, do you want to make that announcement now?
Yeah, might as well. August the 19th, place and time to be determined, but we will reconvene to keep this ball rolling down the hill, so to speak. But really, and this is just from my perspective, the way we're going to combat this, first and foremost, is through grassroots efforts. We've heard the law enforcement panel say we're not going to wrest our way out of this. Many of the treatment providers will say we're doing all we can. but we still have waiting lists. Until this community owns this issue, until we step up to the plate and say, this is not just somebody that I know of. In fact, I'd like to ask this question. How many people in this room know somebody that's addicted? Maybe not to heroin, but just any kind of addiction. Everybody in this room, pretty much. Now, the next question is a little bit more difficult. How many people know somebody that's died from their addiction? This is a problem. When over half this room knows somebody personally that's died, and until we take ownership of it as a community, we're not going to make a lot of progress. You know, I don't know if the parents are still here, the Mims and Tracy, but Baker and Madison's death was not just a death for them. We lost two quality individuals to our community. We lost potential in those children that will never be realized. And when you look at 56 people in the past year, that we will never see what they can do as an impact to the society is amazing and stunning to me. That we don't do more. And I am passionate about this, but I think it's going to take all of us to stand up and say, you know what, there are 5 to 10 people I need to tell about this. There are 5 to 10 people I need to bring to the next one. And I hope that you hear me clearly. It's not about my organization. It's about saving lives. It's about saving people from this deadly disease. And I hope we can all rally around that and say no more in our community. Because we care.
Thank you, Shandor. And I think the idea here also is, to me, and I think most of you experienced this today, the most powerful thing are these personal stories from the addicts themselves or from the families to really try to get the attention of the community and to raise the sort of grassroots support we need around some of these other policy changes and things and resource changes that need to occur. So we'll move on. Number 2, develop other community communication strategies, including production of a local film on heroin addiction and its impact. And we're thinking UAB, digital media and learning, to do that. In addition, public service announcement, radio, talk show, etc. So this is just a general concept. We do like the idea of making a film. Films have been made. There's some very good ones. Somebody mentioned one from Vermont, which is excellent. The thing that CBS 3340 did, ABC, sorry. Forgive me. Was really good. But anyway, that's just one idea. So other thoughts along these lines?
There's only one thing I was thinking here is PSAs work beautifully. And we do LinkedIn and Facebook. We all do our own PSAs. If we learn to click on share, if you see a fact, I'm going to be doing about 10 facts that I got from here. Just a sentence, and if you care, and where to go. I don't know where to send them, but and that's what I need y'all to tell me. And everybody who's in my group, probably 2 of you from here, but click on share, and it shares to your group. And nobody does that when it really needs to get out there, and that's a guerrilla marketing at its best.
So then we can give you all some tools to then go viral on social media, is what you're saying. Right.
But you're talking about maybe a guerrilla marketing campaign to get the information out, which I think it would be great to use new media, since this is a new age group that's primarily involved.
Another avenue through high schools is every high school student in the state of Alabama is required to take a health class. And if there could be some curricula available to high school health teachers, and that could be disseminated through high schools, it would reach a large audience that way potentially.
Right.
Going off of what she said about going to the high schools, when I was in high school, I was in broadcast journalism, and we were tasked to make a video about drunk driving and interview families who had lost a child to a drunk driving accident. And if you could task some high school journalism team with interviewing relatives of people who have died from addiction, or talking with recovered addicts, and creating a video for students to watch in their health class, that would be one way to get more people involved.
Great. Yeah. Good.
What about, I know one of the speakers, I don't even remember who it was now, spoke about a commercial, commercials that we never do see. What if we did do a commercial like that, like a public service announcement? With the statistics. And, I think it would probably, the commercial, or wasn't a commercial, the segment that the TV station, did do, if we did like a little public service announcement, I don't know who does that. Would that be the federal government or the state of Alabama?
So it could be done any number of ways, but it's a really interesting strategy to include with the PSAs. I was struck by that comment too when it was made.
I'm not sure there's a venue, what the venue might be, but with school groups or children of the age that where you want to steer them in the right direction, or at least give them some guidance, taking them to some place like perhaps drug court, having Judge Owens perhaps meet with them, or maybe they can witness some proceedings to where they see what's going on and learn that there are people like them who have made some bad choices and have put them in a difficult place. Again, I'm not sure how to work that, but something along the lines of Scared Straight might be a worthwhile program for our area.
I think it's a great kind of starting point for us as a community. My concern is that when we do interviews with students themselves, they don't seem to buy into the scare tactics that those programs use. What we do see, though, is that they are very relationally motivated. And the more that we can do in our packaging and in our information to talk about how drugs affect your relationships, whether that's through your parents, whether that is through your boyfriend, girlfriend, spouse, however, those are what we see are actually making an impact. And I think those are the things that we should do focal groups around to really kind of figure out, A, what is our target market for these ads? Is it just a generalized message that we're going to try to get to the community, talk about the issue, or are we going to really focus on segmentation and figure out, okay, with students we need to have this running, for parents we need to have this, for individuals that need to seek help and treatment, then there's another different type of ad we can run with. And I know that, trust me, I understand the amount of cost that adds to it. But I think if we're going to be effective in these types of things, we got to figure out how do we segment and how do we use the best of our resources, whether that's social media, regular print media, which I know people might laugh at me when I say that, but those are the things we've really got to look into.
Yes.
I don't know what the research shows about the effect of the Zero Meth program, but there was were y'all involved with that?
Yes.
But there was a video that was sent to schools, and it was sort of the same kind of thing, a lot of testimonials, where if you can't take people to jails and show them this is what's ahead, they brought the testimonials from the jails to the schools. And of course, I agree with you, there's got to be a broad spectrum approach, a lot of different ways to approach people, and certainly a one-on-one relationship is most effective, but we can't do that with everybody. And I used to tell my students, I'm an assistant principal now, I've been a teacher in a high school for many years, and I'm also an RN. And someone said early in the day, there's a segment in the middle. I used to tell my students, some of you are going to make this choice no matter what I say that's positive, some of you are going to make this negative choice no matter what I say, but I'm talking to the ones in the middle. And education is going to get some people, but it's a lot bigger than that. It's about motivation. But if we give them the information, some of those through maybe these testimonials, whatever, some of these kids are going to be affected. But motivation, that's going to come through relationships and a myriad of other things as different as every individual we're trying to reach. But do we have any data about the effectiveness of the Zero Meth program?
So it's interesting that you raised that. I've actually been looking at that. Jimmy Harp is the DA up in Gadsden who did Zero Meth, and I thought it was an interesting model to look at for heroin. My office has been able to set aside a little bit of funding that we hope will help produce a video in connection with UAB, and the stage that we're at now involves the UAB folks using students to do a little bit of research to explore what sorts of messages have an impact. because I'm a big believer in using evidence-based methods. We all have limited resources, so if all I have is one shot at doing it, I want to take a little bit more time and figure out what works. And I've heard Shandor's comments about relationships being the driver to helping kids listen to the message. I think that's fascinating. And want to use some Department of Justice resources to track down just what the statistics shows work, so that as a community, if I can bring these resources to the table for us to have, we can come up with a message that our kids will hear, whether it's zero meth, scared straight, or something completely different.
Well, certainly facts make an impact. If they just have the truth, if we just tell them the truth, and then a lot of other things too. But we got to give them the facts, the objective data, the truth as a basis for making their choices.
We'll
Thank
take
you.
one more comment on this and then move forward. Go ahead.
Very quickly, evidence-based science is what I've done for years as a registered nurse and case manager, working with a QIO in the state quality, the Alabama Quality Assurance Foundation. And one thing we did was tag on to other evidence-based programs. This is tailor-made for a connection with what the ADPH does already, the 1-800-QUIT-NOW. They have capacity with not much more of a contract. If we say the state says yes to this, they do the 1-800-QUIT-NOW for smoking cessation. They've got the master's prepared counselors there in Mississippi, and they would love to have a contract because this is how to quit with an addiction. It's the exact same science that they're teaching, and it's a beautiful program for probably 15 years. Just a thought.
Okay. The next one here is to convene area medical professionals, the ones who prescribe the opiate pain medicines, for strategy session on ways to address over-prescribing of controlled substances and reduce unintended diversion of controlled substances. I was pleased to hear the Medical Society today in not only as they were up here, but also on side conversations to commit to hosting or convening this particular strategy item to bring together medical community to try to strategize on what to do next or what to do more than they've already done. So any comments on this particular idea before we move on? Yes.
Hi, my name is Becca Savage. I'm a pediatrician, and I work in adolescent medicine at UAB. I'm actually a fellow in adolescent medicine, so I'm finishing my first year. And I just wanted to speak, since we were on the question about medical professionals, just from the context of pediatricians. I came up with the last panel that we had. I don't know if there's any other from the Department of Pediatrics here, but I work there, and there's an adolescent health center, and there's adolescent attending physicians down at UAB, and we're all very interested in helping this population, as you all might think. That I just wanted to bring the perspective of the pediatric community as well as an important piece of the strategy here, because I'm very interested in substance use. I have substance issues in my family, so that's part of my interest, I think. But specifically with teenagers and all the things that we talked about with the recent panel about prevention. And I'm interested in seeing how, first off, pediatricians in general in this community and in the state, looking into sort of their comfort level and assisting them in comfort and actually completing an appropriate adolescent, evaluation, meaning like interviewing adolescents separately from the parent. I think that's important, but also speaking with the parents to educate the parents. We have to all keep in mind that takes a lot more time than your 10-minute pediatric visit or 15 minutes. So that's part of our clinic here at Children's. We spend a lot more time. Thankfully, we have more time. So thinking about that, also getting pediatricians to work with schools, which I think is really important, because teenagers do not go to the doctor unless they're sick, right? And well, first that'd be educating parents that yes, your child needs to go to the doctor at least every year. And if there's any issue, if the pediatrician picks up on a substance use issue, they need to be seeing that patient back for follow-up visits, not just, well, we'll see you next year kind of thing. They also, I'm sorry, I'm talking so much, but the American Academy of Pediatrics and NIDA and lots of different federal groups are all sort of pushing this within children and adolescents, this importance in primary care in peds, and a lot of family medicine docs can know about this too, about screening, brief intervention, and referral to treatment. It's like this big new push that you kind of see everywhere now, and I'm really interested in this as well. But how to teach pediatricians to screen every person, first off, then know how to intervene when you do get a positive screen. And I think that's where sort of we break down, because I don't know many pediatricians either. I just finished training, and we don't talk about this. I just finished residency training like last year, and we just don't get educated on this. I was the one educating my peers about it based on what I'd read. So, and so you can imagine pediatricians in the community at large just don't really know where to go. All right, we have a positive screen, now what do I do? Like, I don't know what to do next. So, and then working with schools, because like I said, the teens don't go to the doctor unless the parent makes them or they get sick. And then schools are the first line, I think. And so I'm really interested in working with schools to try to help figure out how the medical community and schools can work together.
So Dr. Savage, can you make sure that this group is connected with the adolescent pediatric community?
This group, like you guys? And
that we're talking about convening here.
Oh, yes, yes, yes.
That would be great.
That would be great. That's what I brought up.
Thank you so much. So the next one, number 5 here, is convene various stakeholders and policymakers to develop consensus and strategy for policy change. This is the 911 Good Samaritan policy, as well as expanded availability of naloxone, which is mentioned several times. Does everybody know what the 911 Good Samaritan policy is? No? So this was briefly mentioned, but this is a policy where well, first of all, about 80% or so of addicts, when they use heroin, are not using it alone. They're with other people. About 80% of them that are found with a needle in their arm dead are alone. So what's happening is when somebody gets in trouble, people panic and they split the scene, or they might rush them to the hospital and kick them out the door of the car on the doorstep of the ER and drive off. So this policy would make it so that law enforcement would make it, if somebody calls 911 in a drug overdose situation, the person who makes the call or the addict who's in the overdose does not get arrested. They're protected from that if they make the 911 call. That would, details have to be worked out. It wouldn't make them immune from other prosecution of other crimes, but for minor possession charges and things like that. So this has been done in several other states, but I think we need to have a conversation about it with the various stakeholders, try to get a consensus, and then develop the support that we need to make the policy change. Yes, Foster.
It's a harm reduction strategy.
Right. Yeah, and this is where we mentioned earlier about the people drowning or coming down the river. This is throwing them the life buoy.
I mean, and we have seatbelt laws, and they don't prevent wrecks, but they prevent injuries when we have those wrecks. And I mean, that's a harm reduction strategy.
Right.
And we drafted a piece of legislation that was introduced in the last session, which was just a limited liability bill, which would allow police officers to have naloxone. But I would suggest that given the energy behind this meeting and whatever, that we need to look toward a broader bill and get some energy behind it, such as a Good Samaritan law. And I think that is something that we should do.
Yeah, and what we're talking about is actually convening perhaps at a certain date and time, get the right people in the room, including some of the folks with the personal stories, and get them together with the lawmakers, and let's come up with an agreement. And then another one for law enforcement, this was mentioned before, linking the dealers to the deaths and adding that 20 years mandatory sentence. And that's something you've already committed to doing. Max, you want to talk about wicked problem?
Sure. At the School of Public Health, we've had for 3 years now a thing called the Wicked Problem Case Competition. For some of you that are not aware, wicked problems are considered those problems that are multidisciplinary, don't have simple solutions, and the attempted solutions actually uncover more problems, but it's a way to approach very sticky, difficult problems. The idea here was to create a competition like we've had at the School of Public Health among teams that would, teams of high school students, college students that would compete around a scenario related to the heroin epidemic or something related to it. The primary reason being that the view and the insights and the creativity that come from high school and young college students is really quite remarkable, and we'll have different types of solutions than you might get otherwise. And the way that we've done this at the school is they get the case, they've got 72 hours to get the answer, they present to a panel of judges, and the ones that are selected winners get a small prize. So it's an idea.
Any other thoughts on that? I guess the general concept is getting more peers involved in the solutions. UAB School of Public Health and others identify funding opportunities for research and evaluation of community efforts. Sort of speaks for itself.
Yeah, and I think I'll just pick up on number 10, because 9 and 10 kind of go together. I've got the words backward, but the idea was to establish a Center for Addictive Behaviors and Addiction. This is Dr. Tucker's idea that is about a year in generation, and the timing is actually perfect. The idea here being to use a focal point, bring together the resources of the university around addictive behaviors and addiction to understand some of the more complicated aspects of prevention, strategy, policies. So this would be really a research center rather than a treatment center, but would also be a way to identify funding sources.
Thank you. And if we have ideas in our community that or things we're trying to do, we have a way to evaluate them.
Yes.
To see if they're really effective or not.
Right.
So I have a comment.
Yes.
Last two. As I looked around at the average age of the audience, I realized that a lot of people in Birmingham don't realize that Max and my name is Jess Milby, emeritus professor at UAB, had a opportunity to develop the third recognized effective treatment for cocaine dependence in the world's treatment literature. And since we did that, we have expanded and learned how to treat addiction more effectively. But the frustration is that with these federal grants, Max realizes this too, when the agencies that we collaborated with had to try to put on the total manualized evidence-based intervention, they could not afford to do it. And so what was an effective manualized intervention? 5.5 to 6 hours a day, 5 days a week with professionally trained people who were committed to the program and had lots of expertise and lots of experience. The community could only provide could only support part of that intervention, like maybe 3 mornings a week for 2 hours. That's not even close to the sufficient dose of effective treatment that's needed. So my concern is with, and I've heard a lot of talk today about the amount of money we're spending on drug abuse probably nationally, but very little about how we can sustain effective programs in our community, ones that we know work, ones that have contributed to the world's treatment effectiveness literature. So it seems to me that if the community might consider the possibility of stipending effective treatment programs in the community for what it costs to actually put on an effective intervention, with aftercare and follow-up and everything that goes with it. I'm talking about contingency management programs that have real sustained abstinence outcomes at plus 70% after 2 months. If some of the community budget for corrections could be stipended to these effective programs, then they could sustain that manualized effective intervention and make it available in the community for those who are appropriate in the correctional system. Of course, I think we have a way to do that with presiding judge approval, but don't have that system in place. And I think that's a really critical need.
It's incredibly interesting that you're making that comment today. Not sure if anyone's aware, but the Council for State Governments is actually down in Montgomery today, part of a week of consultation. It's a bipartisan process, believe it or not, in Alabama, that involves the leadership of both houses of the legislature, the governor, the head of the Department of Corrections, the Chief Justice of the Alabama Supreme Court, and they are exploring what's called justice reinvestment, which is absolutely what you're talking about. And so
That's correct.
I think it would make sense if the Council for State Governments folks were able to talk with you, and if some of this were expressed. So if you'll make sure we talk afterwards.
Be glad to.
Good deal.
All right, this is the last of our ideas that we put on paper here, and this is just to convene members of the addiction treatment advocacy community to develop a strategy to better coordinate, connect people to addiction resources, and to advocate for expansion of available treatment resources in the local community. This is pretty idealistic. I know a lot of you are partnering already, but we still wondered about the possibility of getting more people together with a more robust effort with more community support to say we must have this in our community. Any other big ideas that we're missing, like major categories? Or have we got it reasonably well covered? Save the date, August 19th. Any final words, Joyce?
I think that's the final word. Save that date, get word to your friends who've had to leave, and please be open to conversations leading up to that meeting so we can do a good job with this.
Thank you all.